information. If I need to slow down or repeat anything, let me know. So the name of the technique is frequency-specific microcurrent. The history is that frequency-specific therapies were developed in the early 1900s, mostly by MDs and osteopaths. In the US, the UK, and Germany, there was an explosion in interest in electromagnetic therapies between about 1905 and about 1934 is when they had to go underground. They were used by thousands of physicians until 1934. And starting in about 1910 to 1917, medicine labeled them all as ineffective fakes. The pharmaceutical companies were just starting to be grow and become prominent. They decided that medicine decided that drugs and surgery were the only tools of medicine. Nutrition, herbs, homeopathy, and frequency therapies were outlawed. And pretty much every medical intervention except for prescription medication by 1917, 1920 was outlawed. You okay? Who's Guy? You okay?
Yep, we hear you.
Yes, we can hear you.
Okay. Hello?
Yep, we hear
Yes.
you.
Okay, we're okay?
Yes.
Okay. So by 1922 to 25, any physician who used electromagnetic therapies, herbs, homeopathy, would lose his license. So these devices went into the back rooms, got covered up with a sheet. The research and the history was lost. And the practitioners were persecuted. A number of them went to jail. So this is a picture of one of the original devices and somebody's grandfather's medical office. This is the library where all the research and the books and the journals, there's Electromedical Digest, the Pathometric Society, all of that was here. And when grandfather died in 1940, 45, 50, all of that history went on the junk heap. Well, Harry Van Gelder was an osteopath from England who bought a practice in 1946 that came with a machine that was built in 1922. He walked into that clinic, walked into the back room, saw something under the sheet, took the sheet off, saw this machine, and under the machine was a list of frequencies from 1922. George Douglas is a chiropractor from Western States Chiropractic College, and he went down to California to work with Dr. Van Gelder in 1983 and brought home a copy of the list of frequencies, stuck them in a drawer the way we do, and forgot about it until 1995, when I graduated from chiropractic college in 1994 and I started treating fibromyalgia patients. And he was moving his office and found this list. And the list has two channels. In the office, we have a 2-channel microcurrent machine. This was the Precision Micro. It's an analog 2-channel machine. It was made in probably 1991 through about 2010. And we started to apply the frequencies with the 2-channel microcurrent device in 1995. All of the history about how the frequencies were derived has been lost. There's no way to retrieve that. It's gone. Mechanism of action, you're going to see that we have a pretty reasonable model based on the data that we've got. And I can tell you the 1920s equipment was not microcurrent. So at first I just treated muscle pain. In 1995, I had a myofascial pain and fibromyalgia clinic. And we first used the frequencies to treat muscle pain in 95, 96, 97. Our outcomes in 96 were so remarkable that I had to find out if it was reproducible. So I started teaching them in January of 97. By June of 97, we knew that the frequencies were reproducible. And since then, I've kept teaching it because it would be immoral not to. The benefits are consistent and the effects are teachable and reproducible. And then research over the last 25 years, 20 years, have accumulated, and everything is consistent. So that's what we're going to look at. What you need to know about frequency-specific microcurrent, the short version, is that it makes everything we do in medicine, physical medicine, functional medicine, neurology, internal medicine, it makes everything we do more effective, more efficient, less expensive, and improves patient outcomes. So my next job is to teach you how that's going to happen. So think about what would happen to your outcomes and your patients if you could reduce lipoxygenase-mediated inflammation by 62% in 4 minutes. What would happen if you could reduce COX-mediated inflammation by 30%? That doesn't sound as good, but in a blinded animal trial, that was equivalent to injectable Toradol. Reduce all of the inflammatory cytokines, and the current by itself in 3 different studies increases ATP or energy production by 500%. So what would happen? Oh, come on. Are you serious? Great. My computer just locked up. All right. Let's go to the next one. So we are used to a biochemical model for how the body works. So we are used to the concept of using drugs and supplements. So you can take Advil or you can take turmeric, but all of them work through a biochemical model of understanding how the cell works. Drugs and nutrients change function by cell function by landing on a receptor on the outside of a cell like a key in a lock. Those receptors change their orientation based on what the drug or the supplement does. That activates kinases, transcription factors, and basically in the case of Advil or turmeric, causes the cell to produce less inflammation. If you have tissue fragments or bacterial fragments, they land on the receptors, change the kinases, the transcription factors, and cause the cell to create inflammation. So we think of it from a biochemical perspective. But what we found in animal research and in my clinic is that one frequency reduced inflammation. So in animal research done at University of Sydney in 2003, one frequency combination, this is a 2-channel system, 40 hertz on channel A and 116 hertz on channel B. They paint the mouse's ears with arachidonic acid, the ears swell, they measure the swelling mechanically. This is Wayne Riley, he's holding on to this little hairless mouse with graphite conducting gloves. And then somebody measures the ears. So when you paint arachidonic acid, you get lipoxygenase mediated inflammation, and the swelling in the ears went down actually by 70%. The researcher in 25 years of doing this had never seen any prescription or non-prescription drug that reduced inflammation by more than 40%. So she shut down the lab, sent everybody home, brought everybody back, blinded everybody, put in a placebo frequency, turned the machine away from the operator so he couldn't tell if it was on or not. And with everybody being super careful and blinded, there was a 30% reduction in LOX and a 30% reduction in COX. And it was a 4-minute time-dependent response. So half the response is there in 4 minutes, the full response, half the response is there in 2 minutes, the full response is there in 4. So they tried plain non-specific current, just 1/10 of a hertz, something like what you get with just an over-the-counter microcurrent device. No reduction in inflammation. Our frequencies for reducing inflammation in the bone, no reduction in inflammation. Any other frequency that we used, no reduction in inflammation. So they were all equivalent to placebo. So I want you to think about what would happen if you could reduce inflammation by 62% in 4 minutes in irritable bowel, inflammatory bowel, Crohn's, leaky gut, liver disease, pancreatitis, rheumatoid arthritis, asthma, dementia, traumatic brain injuries, depression, anxiety, nerve pain, neck pain, low back pain, and joint pain. Think about what your practice would be like if you could do that in 4 minutes. So, in case you're wondering, your more difficult patients are often diagnosed with I'm going to stop when I hear that kind of noise. I don't know what's going on in the background. So let me know if something needs to change.
Keep going.
And fibromyalgia associated with spine trauma, this is what the pain diagram looks like. The patients walk in with their pain at about a 7, and we found one frequency combination that reduced pain, and only one frequency combination that reduced pain and inflammation. I took this data, original data, to NIH, gave a lecture at Grand Rounds, and we got cytokine data from NIH. I said, we need something objective because nobody's going to believe this. And what we found is that all inflammatory cytokines reduced in 90 minutes. Patients recovered from fibromyalgia in any place from 3 to 6 or 8 months. So 58% of patients who were treated in this paper, in this study, recovered from fibromyalgia within 4 months. Recovery programs were individualized: gut, adrenal rehabilitation, medication management, withdrawal, physical therapy, reconditioning. The treatment's simple. There's nothing you do with your hands. You put a contact around the neck, put a contact around the feet, punch a button, leave the room, and come back 60 minutes later, and there's pain is down from a 7 to a 1. When I got the data from NIH back, we found that interleukin-1, which is associated with nerve inflammation in this index patient, went down from 392 down to 21. In case you're interested, if you're using medication to reduce interleukin-1, it takes 3 months, and it's hard to change, and it changes by about 20 to 30%. It doesn't change by a factor of 10 times in 90 minutes. This kind of cytokine data is unheard of. TNF-alpha, so you're all familiar with the TNF-alpha blockers that they use in rheumatoid arthritis and autoimmune disease. Those TNF-alpha blockers take 2 to 3 months to work, and they reduce TNF-alpha below normal. The difference with this data is that TNF-alpha went from 300 down to 20, and it stays inside the normal range, right? So normal is 0 to 25, and this stopped in the normal range. The medications that you use to reduce TNF-alpha take them down below normal, and that's why people get cancer and infections when they're on these medications. Interleukin-6 went down from 204 down to 15. Those p-values have 2 zeros. Substance P is manufactured in the spinal cord. So the frequency we use is 40 hertz on channel A to reduce inflammation, 10 hertz on channel B to address the spinal cord. So the system calls for conditioned tissue. And substance P is manufactured in the spinal cord. So when you reduce substance P from 132 down to 10, you know that channel B is indeed affecting the spinal cord. And this patient, her pain didn't go down a whole lot, but these patients, there's no scatter. All of them, the spinal cord, the substance P from the spinal cord dropped by factors of 10 times. Endorphins go up. Patients get really floaty or stoned when you do this treatment on them. So by the time you're 30 minutes into it, endorphins have gone up by a factor of 4 times, and they're pretty floaty. They'd really rather not talk to you. Cortisol goes up, but that's a result of reducing, of increasing endorphins. And when you increase endorphins, you increase ACTH. So we know it's not a stress response because neuropeptide Y goes down. And neuropeptide Y follows the sympathetic nervous system. So the pain goes from a 7.3 to a 1.3, and that p-value, which is a measure of statistics, significance, that p-value actually has 6 zeros, but you never publish more than 3. That means there's less than 1 in a million chance that this was chance. All patients had pain relief. 58% of fibromyalgia patients recovered in 4 months. We had probably 20% of them dropped out, mostly because if you've been in pain for an average of 14 years and your pain goes from a 7 to a 1 in 90 minutes, you kind of have to wonder who you are. It changes your identity. We still have 60% reduction in or recovery of fibromyalgia patients. The current by itself increases ATP by 500%. This is in Nak Cheng in 1982. So just the current increases ATP production by 500%. That increases protein synthesis by 70%, amino acid transport, increased cyclic AMP, that's in Seeger's work, in human lymphocytes. So this was in vivo. And then it activates signal transduction. So just the current is helpful. We know from the animal research, the current by itself won't reduce inflammation, but it helps people feel better, which is why non-specific microcurrent devices and non-specific pulsed EMF devices, this is why they work. It moves electrons through the electron transport chain and increases ATP. That's useful. Microcurrent devices were approved in the 1970s as if they were TENS devices, even though they're not TENS. They use 1,000 times less current. They were approved for aesthetic use, that is not prescription. They're used for wound healing and pain control. Microcurrent devices vary widely. Different waveforms, 1 or 2 channels, combined units, ultrasound, interferential, galvanic, and micro. They plug in the wall. These devices are battery operated, so it's DC current. In general, with microcurrent devices, frequencies are not important. So when we first started using FSM, that old blue box, the analog device, was the only one out there that had 2 channels, and where you could set a 2 or 3 digit specific frequency. To do FSM, you need a device with 2 independent channels where you can set a 3 digit specific frequency like 284 or 396 on each of 2 channels. And then you have to have a screen that shows what frequency is running, because if the patient has a good response, a side effect, you need to know what caused it, because the frequencies are very specific in their response. Frequency-specific microcurrent is not about the device. It's about the effect of frequencies on cell receptors and cell function. So FSM, this is an FSM patient who had diabetic wounds, as you could see, lots of swelling, 7 centimeter wound on the medial side of his left leg. He had a necrotic toe. This toe was set to be amputated. This toe, they were going to wait until this one was worse and then do both toes in the same surgery. He had sensory loss in 7 out of 10 areas. And all of this was healed in 6 weeks in 6 to 11 treatments. So, and it's easy. Treating diabetic wounds and diabetic neuropathies, his sensation was completely restored in 4 weeks. Towel, it's unattended, so you place a wet contact or even sticky pads at the knees and on the feet, and punch a button, leave the room, come back 60 minutes later, their pain is down, their sensation is improved. And if you do that 2 or 3 times a week for 4 weeks, you can get this kind of response in wound healing. FSM is really good, useful for anti-aging because the current by itself increases blood flow. This is in rabbit research at University of Washington. So 14% increase in collagen, a 48% increase in elastin. In rabbits, it was an hour a day, 5 days a week for 4 weeks. And this study was done by graduate students. But this is what happens when you run the skin anti-aging program on a patient. She's already pretty. But you look at the orbital lines and the labial folds, and this is after 3 times a week for 2 weeks, twice a week for 2 weeks. And then gravity always wins, so it's once a month for maintenance. But there are some people that use FSM just at lunchtime, and they run skin anti-aging protocols on patients. So this is the frequency to reduce inflammation, 40 hertz, in the liver. This study was done by, I didn't put his name on here, Joe Suddich. He's a naturopath in New Zealand, in Auckland. Had a 63-year-old male. Went on an alcoholic binger over the weekend, came in on Monday morning with fatigue, nausea, digestive problems. He clearly had acute alcoholic cirrhosis. And so on Monday, they did his enzymes, and AST was 75 with a normal of 0 to 45. ALT was 222. GGT was 383. Now, the normal course for liver enzymes is they go up for about 10 days to 2 weeks, and then they start coming down. The enzymes are in the blood because the liver cells are coming apart, and so the enzymes come out of the liver cells and go into the blood. So 2 days later, this kind of increase in AST is not unexpected. What you would expect in a patient with this kind of increase within 2 days would be that over the next 7 days, this would go up to about 1,000 or 1,200. So on Monday, Joe just told him to stop drinking, gave him some supplements. And Wednesday, the patient came back and his AST was 582. And they did a 60-minute FSM treatment with just basically for 30 minutes running the frequency to reduce inflammation in the liver. That was at 9 o'clock in the morning. They did the blood work. They treated him from 10 to 11. He went back over to the hospital, had his blood drawn. And at noon, his AST was 36. ALT was 133. GGT went down from 709 to 493. Some of this slide is missing. What we know is that this has been reproduced in 2 clinics in California over the last 10 years. This was done in 2005. So it's reproducible. It's not a lab error. And reducing liver enzymes and liver inflammation is pretty easy. The clinical response, so I got a list of frequencies with a number, a frequency, and a word next to it. So the word, inflammation, we assumed was to reduce inflammation. And next to that word was the number 40 hertz. So you run 40 hertz on the first channel, and you put a tissue on the second channel. And that 40 hertz would reduce pain, redness, swelling. Didn't do anything for range of motion or scar tissue. The frequencies for fibrosis and scarring. Resolve scars, increased range of motion, doesn't reduce pain. Frequency to stop bleeding. Stops bleeding and pain in the menses, prevents bruising. So you have a patient who has a hip replacement, and if you can get this frequency on that patient within 4 hours of time of surgery, they don't bruise. Anybody in the audience seen a patient after a hip replacement? They are black from their hip to their toes, and they don't bruise if you can get the new injury protocol on them. Frequency for shingles, reduces pain, eliminates lesions and shingles and in oral and genital herpes. And there is one frequency combination that is so far effective in every case to reduce kidney stone pain. Doesn't do anything for the stone, just reduces the pain, which if you've ever had a kidney stone is a good thing. So at this point, we know we can do this stuff because we have the research, we have the case reports, we have the published papers. You ought to be asking, okay, fine, how do specific frequencies change conditions in specific tissues? Well, most of everybody in that room has been trained in science. We all had to take chemistry and physics and math before any sort of medical training. As you recall, science starts with observations. So we have to explain what we observe with frequency-specific microcurrent. So what we know is the frequency changes are immediate. They are time-dependent, but they are immediate. The tissue softens, it goes smush, pain goes down, and it starts within 10 to 30 seconds. May take 20 to 30 minutes to complete it, but it starts immediately. There are immediate changes in sensation. Some patients will feel warmth, some practitioners feel warmth, and come on. Sorry, my computer just keeps locking up. So the fact is that the human body is a quantum biological system. Now, Newtonian physics describes large bodies, like your body, my body. You drop it off a roof, it accelerates at 32 feet per second per second. But Newtonian physics falls apart at the molecular level. So your body is a Newtonian object that's made up of quantum molecules, atoms, and subatomic particles that are held together by electromagnetic bonds. And every bond has a frequency at which it resonates. The other thing you need to know about your body is it's a semiconductor. So semiconductors work because there is a single hole inside a silicon matrix, and the electrons can flow in a controlled way through the silicon. In your body, water lines gel that fills your cells and forms structures where the water molecules flicker and have a hole where the water is. So it's an electromagnetic system that looks solid, but the cells function as a semiconductor network. That means your body conducts current. You're polarized positive at the top, negative at the bottom, positive at the center, negative distally. You can have charge, and your body communicates with information. Now, resonance is the tendency of a system or a bond. FSM is considered resonance therapy. Resonance is the tendency of a system or a bond to oscillate at large amplitudes in response to some frequencies and not others. At the resonant frequency, even very small forces can produce very large amplitude vibrations. Those of you that have been in the military know that when a company of soldiers is marching and they come to a bridge, they break step because somebody found out in the 1800s that soldiers marching across a bridge in step could create a resonant harmony with the frequency that holds the bridge together and cause the bridge to come down. Resonance explains the immediate effects. So when a singer sings a note that breaks a lead crystal glass, that works because there's a precise frequency holding lead atoms together in a 70% lead crystal matrix. Lead atom bonds vibrate with the singer's note if it is precise and sustained, and the lead crystal just comes apart. Biologic resonance works the same way. Drugs or nutrients act like keys in a lock to change membrane receptors and intracellular function. If you take an Advil, your body, your cells stop producing as much COX-mediated inflammatory products. Biologic resonance explains the effect of frequencies on living tissue. You all use a key remote, a key fob like this, to open your car door. Drugs work like a key. The frequencies work on your body like your key remote opening the lock with an electromagnetic signal. As far as we can tell, what happens is the frequencies appear to change the membrane protein configuration and cell function electromagnetically. So membrane receptors respond to frequency signaling. Those receptors configure in response to stimuli, information, and frequencies. That activates kinases, that alters genetic expression, cell function, and ultimately cell structure, because we can take apart scar tissue. You alter genetic expression. The way we know that is that the frequencies stop the cytokines in the normal range. If we were addressing the cytokines themselves, they would drop below normal. They stop in the normal range. So functional medicine, physical medicine can be more effective, more efficient, less expensive. You will still do what you do in practice. Frequency-specific microcurrent has its job to make your job easier. When you can reduce inflammation, dissolve scar tissue, FSM changes the tissue quickly, but it still needs manual and exercise therapy, nutrition, and lifestyle changes for lasting and permanent results. So the lasting effects, the correct frequencies create instantaneous changes in the tissue and change the state of the tissue. So water changes state to go from ice. It's ice as long as the surrounding environment is 0 degrees. It turns into a liquid at 1 degree. It turns into steam at 100 degrees. The state of the water depends on the surrounding environment. So the changes can be permanent that you create with FSM when the patient's metabolism, attitude, mechanics support the change in state. Stable state in a human system is pretty complicated. Stable state is what you do for a living. My job is to make your job easier. So 1997, it's low risk, reproducible, teachable, reliable, non-invasive, comfortable. It's billable. It's approved as a TENS device, as for those of you that see insurance-based claims. So we've dissolved scar tissue in chronic burn patients. This was done in 2003 at Mercy St. John's in Springfield, Missouri. This is Shingles. It's published in Practical Pain Management. That is the bald head of Dr. David Simons. For those of you that treat myofascial pain, Dr. Simons wrote the trigger point manual. And I was married to him for the last 5 years of his life, and we treated him for shingles in 2007. Pain-free in an hour, no return of pain. And he was 85 at the time. 85-year-old men do not recover from shingles in the ophthalmic branch of 5. That's why they published a single case report. Cervical myofascial pain, there's those of you that treat neck pain, low back pain. We have published papers in that. The core seminar, the 4 or 5 day seminar, the first 2 days is treating myofascial pain, nerve pain, neck, low back, disc, facets, nerves. This paper was published, nerve pain. For most of you, if you've ever seen sciatica or radiculopathies where somebody has pain from nerves in the neck, nerve pain is the most challenging kind of pain that they treat in medicine. And for us, it's the easiest thing we treat. Like, it's really simple. 40 hertz on channel A and 396 hertz on channel B. You put a contact where the nerve comes out. You put a contact at the end of the nerve. And we dissolve nerve adhesions. There's a paper on that. We have EEG data on treating autism. So in this case, before treating, higher numbers are better when it comes to EEGs. Week 2 post FSM. This is a stroke patient. She was 38 years old. She had sleep apnea. She had a stroke. It was 3 years chronic. Her hand and arm were spastic, had not moved in 3 years. And at the end of 1 hour, she had her arm above her head with the current off. We just treat increased secretions in the sensory cortex. This was 5 days later. We did a second treatment, and that was pretty fun. Sympathetic, the frequencies change autonomic function, so you modulate the sympathetics and parasympathetics at will in a fairly short period of time. They either work or they don't work. They don't have no effects, and the side effects are transient. You will learn about side effects, precautions, and contraindications. Fortunately for us, medicine's pretty pragmatic. We used willow bark for hundreds of years as aspirin, and we didn't understand anything about prostaglandin chemistry until Advil came out in 1971. So just think about what would happen to healing and everything you do if you could reduce inflammation by 62%, reduce COX inflammation by 30%, equivalent to injectable Toradol, reduce all inflammatory cytokines, and increase ATP production by 500% in 30 minutes. So we have a published paper in delayed onset muscle soreness. Those of you that are athletes, there is no prevention or treatment for delayed onset muscle soreness. You work out, you exercise, you're sore the next day, you're worse the day after that. With us on the auto care and the custom care, we just treat DOMS. This is a published paper. And let's see, nope, I don't have the outcomes. The p-value has 3 zeros. So the pain at the end of the 24 hours in the treated leg was a 2, the untreated leg was a 6, the second day untreated leg was a 7, the treated leg was a 1. This is after a facelift. This lady had a facelift, full face, forehead, mid-face, eyes, chin. Day 2, so they treated 80 minutes immediately post-op and then daily for 7 days. Day 4, day 5, little bit of bruising, but not what you'd expect. Day 6, that's the incision, right? So when they went in and did the forehead, they made an incision there. That incision is completely healed at day 9. This is day 11. If you've ever seen anybody after a facelift, they don't look like this at day 11. Even she's clearly has her makeup on, but at day 11 after a facelift like that, you don't even put on makeup. Mm-hmm. This is normal for us. It makes medicine faster, more efficient, more effective, and improves your outcomes. That's my job. Please. The core seminar in the US is 5 days in person or on DVD. We are splitting it this year into 2 3-day modules, pain and injury on the first module 1, and neurology and visceral treatments in module 2. Lecture, 6 to 8 hours of hands-on practicum, individual attention, immediate competence. The learning curve is forever. I've used frequencies in the last 6 months that I've never used in 25 years. There's advanced courses, webinars, workshops. We take care of you once you are a practitioner. Equipment is relatively inexpensive. It's 510K approved. It's US made. It's got all the ISO certifications that you could want. And I have a textbook that was published in 2010, Frequency-Specific Microcurrent and Pain Management. This is the book you want to read, though. It's called The Resonance Effect, and it tells the story of how frequency-specific microcurrent came to be. And case reports, frequencies are included. As far as I'm concerned, the only way to keep something is to give it away. So I tell people what the frequencies are, and your job is to help patients get better. My job is to help you do it more effectively, more efficiently. This is the last slide. Frequency-specific microcurrent will change your life, your own health. If I swear, if all you do is treat yourself with it, it's worthwhile. Changes your practice and changes your outcomes. Once you see what you see at a seminar, you don't ever get to go back. You can't unsee what you saw. So it changes everything more or less forever. And I think that's the last slide. So where are we for questions?
Yes. So did she answer your question, or she did not answer your question? Would you like?
I was just wondering how the frequency-specific microcurrents compare to like Rife frequencies.
Rife used, our frequencies are all below 1,000 hertz. Rife used light. He used
Plasma?
used plasma, he used light frequencies that were tuned in a microscope. So all of his frequencies are between 8 and 16,000 hertz. The Rife devices, and that's in quotes, the Rife devices that are sold on the internet use electrical pulses. That's not anything that Rife ever did. They're all, and you have to ask, the FDA just came in the morning, destroyed Rife's equipment, destroyed his records, confiscated his records, shut down his lab. He had one student, also in California. That student had one machine. The real question is, the Rife frequencies that are on the internet and in those devices today, where'd they come from? That's my biggest problem with it. Number one, they're not light frequencies, they're using electrical pulses, and Rife never used electrical. The biggest difference, if you had an accurate set of Rife frequencies, they're between 8 and 16,000 hertz. FSM frequencies are between 1 and 1,000 hertz, and they have always been used as electrical pulses. We have a pulsed EMF converter that converts the electrical pulses to frequency-specific magnetic pulses, but it's just a different system. Where's the list? So here's the list. So these are channel A frequencies. These are all the conditions, right? Congestion, chronic inflammation, infection. We don't treat infections with the FSM, but 61 hertz takes down the effect of infections on various tissues. So that's the biggest difference.
Okay, great. We have another question.
The biggest difference is what? The number of hertz? Or,
So light versus electricity.
okay.
The simple way. Light was in the light range, and FSM is in the electrical range.
Okay.
So,
And the number of
Okay. I think she just froze.
She froze.
Sounds like she doesn't think very much of them, of the ones today or whatever.
Yeah, I mean that's a controversy. One would have to get into the field and dig to understand. Yeah, are you back with us? Okay, so Adele.
I've got to check my internet because it's a little note that
So
said
I'll just say the microphone on the camera is not very strong, so often I will just repeat the question if Carol can't hear it. So go ahead.
Can you speak to how we can use this to remediate effects of EMF, smart meters, and 5K that companies are using?
Okay, so FSM to treat EMFs, 5G, and dirty electricity.
right. And basically what we know about EMF is that it stimulates the sympathetics. That's all we know about it. It changes cell communication, and it changes the nervous system. So that's what Becker found, is that it changed it had an effect on white blood cells from 10 feet away when you turned on a 100-watt light bulb. So the concept that EMF creates all these symptoms, we can ameliorate the symptoms. We have a frequency in the advanced for EMF that really seem to help people. The other thing we do is quiet down the sympathetics, quiet down the stress centers in the brain, reduce inflammation, turn back on the vagus. So FSM is a pretty effective vagal nerve stimulator. And the vagus is being used for everything from autoimmune disease to depression to seizures, brain injuries, all of that. So treating the nervous system, that's about 2 days of the core module. And
There's another question coming. I will say on that, this isn't about FSM, but it's either next month after, I can't remember, but we're going to have a talk on treating EMFs. That might be that's top of your mind.
I'm sorry? Are you talking to me?
Nope, I was talking to the group, but we got a question coming for you.
Okay.
Willing to speak about work with mental health in regards to depression, anxiety, and so forth?
For treating depression, anxiety, mental health with FSM?
Yeah. So the slides on autism give you an idea about it. We have data in PTSD, the sympathetics, the parasympathetics. So if you think about anxiety as being associated with sympathetic upregulation, vagal inhibition, FSM is really successful for that. So we probably have, I would say, half a dozen to a dozen psychiatrists, PhD psychologists using FSM to treat PTSD, depression and anxiety, traumatic brain injuries. We've been doing this for, well, the first PTSD study group was created in 2005, so 14 years. And we started treating the vagus and studying the effects of that about 4 years ago. And that has been extraordinary. In depression, anxiety, the data is huge. My problem is I train clinicians and they love treating patients. They don't like publishing papers. So I've got lots of clinical anecdotes. We just don't have a lot of published papers yet, but it's coming. But this gives you an idea about it. If you can quiet down inflammation in the brain, quiet down the sympathetics, the stroke patient shows you that the frequencies we have for the brain work. So when we treat Alzheimer's, early cognitive decline, sleep disturbance, PTSD, the frequencies actually work. If you can do this to somebody who's been spastic for 3 years, you can treat somebody for anxiety, depression, and a TBI. It's pretty fun.
A couple other questions, and I just want to say we have some. Do we have the Fran, did you bring the brochures, ADE brochures? So we have a brochure that has some microcurrent research data in it on mental health, showing some comparisons over against standard of care, SSRIs mostly, and the statistics on it are really impressive. So, and there's some good research. Yeah, Dr. Cinda.
So, a couple questions. What about applications for pelvic floor dysfunction, or also, reflex sympathetic history or complex renal pain?
Sure. Yep. So 2 questions. One for pelvic floor dysfunction, and the other for complex regional pain.
Okay, so complex regional pain is like there's a video on YouTube. So if you go on YouTube and you search frequency specific microcurrent and CRPS, you will see a video of me treating a patient at a core seminar 5 years ago, 13 years chronic, muscle dysfunction, spasticity, just the classic CRPS symptoms. And his pain it was gone permanently at the end of an hour and 20 minutes. So that video runs an hour and 15 minutes, and that patient was treated in 2014 or 15, and it's never come back. It's pretty typical with CRPS. You don't treat that in a 30-minute office visit. You block out an afternoon, tell the patient to bring a snack, and you do it because it is the most spectacular thing you will ever do in your clinical career. It's awesome. We get about, I would say at this point, about 80% complete recovery, 95% improvement. There's still about 5% of patients we can't touch. If they've cut the nerve, that's something, I can't put tissue back that's not there. I can re-afferent and reconnect nerves to the brain. And so CRPS is straightforward. There is actually a group in terms of pelvic pain, abdominal adhesions, pelvic floor dysfunction. That is also fairly straightforward at this point because we can treat the nerve component to it. You can treat the pudendal nerve. There is a gastroenterologist at Cleveland Clinic. We have 2 gastroenterologists at Cleveland Clinic that are using FSM in pelvic floor dysfunction, pelvic pain, and abdominal pain. And the results are spectacular. So when we teach a course in Cleveland in January, and after the course is over, I stay and I work in pediatric rehab hospital for 2 days, and then I go to the GI clinic on day 3, and I see patients with them all day. And it's been just astounding. I'm used to treating what shows up in a community clinic. These people are treating really, tertiary facility kind of pain and dysfunction. And to have FSM work in that setting has been just illuminating. It's amazing. So yes, and look up the video because the CRPS video is amazing.
It's impressive to watch.
Yeah.
Other questions?
How does this compared to Optune, with the glioblastoma and pancreatic cancer?
So how does this compare to?
So it's a company called Optune that has the caps.
Optune. Are you familiar with a company called Optune and treatment of glioblastomas?
No, we don't treat cancer. It's like, I don't want to live in Mexico or the Bahamas. So the problem that Rife had is that he treated cancer and he didn't teach anybody. So Rife was a cautionary tale for me. So from the beginning, I kept a low profile until we had 250 to 300 practitioners. We were too big to stop. And I don't treat cancer. I don't know enough. And if I make a mistake and I do something unfortunate or ignorant and increase pain, it's just pain. If I do something out of ignorance or inexperience that makes your cancer worse, you may not have time to get back on top of it. And I don't want that on my head. So we don't treat cancer. It's an absolute contraindication. And not because it doesn't work, but because it's just not worth the risk. I'm pretty adamant about that.
Any other?
So fatty liver disease, we spoke to fatty liver disease.
Oh, she talked about just liver function.
Well, the enzyme liver talked about
Okay.
What about liver function?
So I think nobody else is putting a hand up, Carol. So I think we
Cool.
can let Carol go and talk to the family. Say thank you, Carol.
Good night. Thanks for having me, Guy.
Thank you, Carol.
Bye.